Pine bark extract has been shown to improve ADHD, decision-making, concentration, focus, memory, and mood. The extract of maritime pine bark is called Pycnogenol, and it contains 65 to 75% pro-anthocyanidins. During Jacques Cartier's 1535 expedition up the St. Lawrence River, the crew were trapped in ice and were dying of scurvy. The crew survived after the native Iroquois gave them spruce beer brewed from the bark and the needles of the pine trees growing by the river. It was speculated the pine bark extracts in the brew contained vitamin C and flavonoids, and this helped the crew to recover. In 1948, a professor isolated the first oligomeric pro-anthocyanidins from peanut skins, and he patented his extraction method for isolating these chemicals. These were also isolated from the pine bark in 1951. In 1965, research was begun, and they developed a water-soluble extract of the same French maritime pine tree, and called the extract Pycnogenol. As a nootropic, pine bark is used primarily to increase blood flow in the brain. Other uses of the pine bark are for the prevention of neurodegenerative diseases like Alzheimer's or Parkinson's, ADHD, high blood pressure, osteoarthritis, chronic pain, and erectile dysfunction. On a molecular level, the pine bark extract helps with oxidative stress, membrane damage, DNA damage, inflammation, and glycation. Pycnogenol helps to prevent a decrease in dopamine and norepinephrine, and also the glutathione and glutathione disulfide reductase ratio, neurotransmitter problems which contribute to hyperactivity in ADHD. Pycnogenol helps to boost the blood flow to and within your brain by increasing nitric oxide, and it helps to dilate blood vessels, and it helps repair and maintain the health of the lining of the blood vessels. Pycnogenol prevents the accumulation of oxidatively damaged proteins, and it might reduce the risk of diseases like Parkinson's, Alzheimer's, and Huntington's. Pine bark extract helps to protect your brain from DNA damage. It helps to reduce DNA damage caused by oxidation. It inhibits pro-inflammatory gene expression, the type of inflammation that's implicated in diseases like Alzheimer's. Glycation is caused when sugar molecules bond to protein and fat molecules. This triggers oxidation and inflammation. Pycnogenol prevents the glycation by lowering blood sugar levels. Damage to neuron membranes disrupts neuronal communication and the structure. The pycnogenol protects the brain cells from the free radical damage, chelating heavy metals, restoring membranes and preventing their rupture and their leakage, helping to prevent a stroke. Free radicals damage DNA and brain cell membranes by causing inflammation. This inflammation is implicated in neurocognitive disorders like Alzheimer's and Parkinson's. Pycnogenol reduces free radical production. It boosts neuron natural antioxidant defense systems, and it's a potent free radical scavenger. Pine bark extract can also boost the cerebral circulation, providing the blood flow that's needed to bring nutrients and oxygen to energy-hungry brain cells. By increasing the activity of nitric oxide, this dilates the blood vessels. The active polyphenols, called the pro-anthocyanidins in the pine bark extract, easily cross the blood-brain barrier. Pine bark extract's main active component is water-soluble polyphenols, including bioflavonoid catechins and taxophylline, as well as phenolic carbonic acids. Antioxidants like the bioflavonoids enhance blood vessel nitric oxide synthase expression, and this then releases nitric oxide from endothelial cells. It's a little difficult to measure blood flow in the brain, so researchers conducted a double-blind, randomized, placebo-controlled study using pycnogenol to study forearm blood flow responses to acetylcholine. The study was with healthy young men before and after 2 weeks of 180 milligrams per day of pycnogenol or a placebo. The group of men using the pycnogenol experienced a significant increase in the blood flow. The researchers then introduced a nitric oxide synthase inhibitor, which completely abolished pycnogenol's induced increase in blood flow, and they concluded it was definitely the pycnogenol that increased the blood flow by boosting the nitric oxide production in the blood cells. Users report supplementing with pine bark extract or pycnogenol has a significant effect on memory, focus, decision-making and mood, and researchers verified this in a clinical setting. In the study, 60 participants aged 35 to 55 volunteered to work with researchers. Diet, alcohol and lifestyle patterns, including exercise, were controlled. Half of the group received 50 mg of pycnogenol 3 times per day for 12 weeks. The other half simply followed a healthy lifestyle. After 12 weeks of pycnogenol supplementation, results showed a 16% increase in mood and an 8.9% increase in mental performance, a 13% increase in sustained attention, and a 30% decrease in oxidative stress. A 13% increase in attention span might not seem like a big deal, but the National Center for Biotechnology Information reported the average American's attention span has reduced from 12 seconds to 8 seconds. This decrease in attention span can have a profound effect on productivity and the quality of work produced, so supplementing with pycnogenol could be the simplest way to dramatically increase your productivity and your income. Poor cerebral blood flow, inflammation and free radicals or oxidative stress can damage your brain, and one of the ways this manifests is memory loss. If left unchecked, it can develop into serious neurodegenerative diseases like Alzheimer's and Parkinson's disease. Cognitive function can decline. Heavy metals can kill brain cells from the inside. Free radicals can destroy neurons and synapses. Anxiety, depression, and moodiness increases. Attention, concentration, and memory declines. Poor cerebral circulation causes a domino effect in the brain, affecting many critical processes like memory, cognition, and decision-making. Pine bark extract and pycnogenol are oligomeric proanthocyanidins, and oligomeric proanthocyanidins have been extensively researched since the 40s. Professor Jacques Mesquier published his doctoral thesis in 1948 on oligomeric proanthocyanidins, phytochemistry, and human health. He discovered the oligomeric proanthocyanidins could neutralize free radicals, which were identified in a number of degenerative conditions and age-related associated changes in the body. He found the oligomeric proanthocyanidins were potent antioxidants. In 1965, research from Germany began on the patented water-soluble pine bark extract called pycnogenol. More than 370 clinical studies have since been conducted, and it shows pycnogenol is beneficial for cognitive function, including memory, mood, and ADHD, antioxidant and anti-inflammatory properties, cardiovascular benefits preventing heart disease and stroke, diabetes by controlling blood sugar levels, eye health by improving blood flow to tiny capillaries in the eye, improved sperm quality and erectile function, menstrual disorders including PMS symptoms, for joint health including osteoarthritis, mobility, flexibility and chronic pain, oral health including gum bleeding and plaque formation, respiratory function like taming asthma and hay fever, sports nutrition for energy, recovery, cramps and better blood flow, and for overall blood vessel health. Pycnogenol and pine bark extract are one of the most potent antioxidants ever discovered. Many users report having more energy and an improved attitude while using the supplement. The effects of the pine bark extract are often not felt immediately, but they seem to build up over time. For some, you could feel a boost in energy around 6 hours after taking it. Adding pine bark extract to your diet should have you thinking faster and clearer. You might get more done and stay focused on things for longer. Chances are you might not feel anything at all until later you realize that you feel normal and you find you're able to recall words and names much easier. Over the long haul, you may realize you've got more stamina and energy, and it simply just makes you feel good. Older users report the pine bark extract reduces age spots, varicose veins, and spider veins. Hair, skin, and nails look smoother and take on a healthy glow. You don't bruise as easily. Allergies and sinus issues clear up. Blood sugar levels return to normal after 2 to 3 months. There's no more hemorrhoids. Leg, joint, and knee pain are reduced. Runners can go longer without feeling exhausted. You don't feel completely burned out after a workout. You might be able to lift more weights and not get as sore. Male users nearly always report more frequent and harder erections, especially when also taking L-arginine, and a higher sperm count, and this is backed by science. Long-term users say they consistently feel calmer, can think quicker, and have better memory. Australian researchers worked with 101 patients in a double-blind placebo-controlled study. The participants received 150 milligrams of Pycnogenol a day for 3 months. The cognitive tasks measured in the study were attention, working memory, episodic memory, and psychomotor performance. The study found statistical evidence the Pycnogenol group developed better working memory as a result of using the Pycnogenol. A 12-week study was conducted in Italy with 60 professionals aged 35 to 55 years. Half of the group received 150 milligrams per day of Pycnogenol, and the other half took a placebo. At 12 weeks, the improvements in the Pycnogenol group were more significant than the controls. Free radicals were reduced by 30%. The group showed improvements in spatial memory retention, alertness, anxiety, and contentedness. The researchers concluded the Pycnogenol improved cognitive function and mental performance. Another study in Italy was done with university students. The objective of the study was to test the supplementation with Pycnogenol on cognitive function, attention, and mental performance. 53 students were given Pycnogenol for 8 weeks. Another group of students took a placebo. The study found the students who used the nootropic experienced better sustained attention, memory, executive function, and mood. The study concluded the Pycnogenol improves cognitive function in normal students. Several studies have been conducted with pine bark extract for its effects on those with ADHD. One study in Slovak Republic gave ADHD children either a placebo or Pycnogenol for 1 month. Research has shown that the concentrations of catecholamines, the dopamine and norepinephrine, were higher in the urine of ADHD patients compared to healthy children. Higher concentrations of dopamine and norepinephrine correlated with the degree of hyperactivity, and both adrenaline and norepinephrine concentrations correlated with higher blood levels of oxidized glutathione. The treatment with Pycnogenol for ADHD decreased the children's dopamine and the norepinephrine concentrations, and it increased the glutathione to oxidized glutathione ratio, leading to less hyperactivity and a reduction in oxidative stress. Another study in Slovakia was conducted with 61 ADHD children. The kids were given 1 milligram per kg per day of Pycnogenol for 4 weeks in a randomized placebo-controlled trial. The children were examined at the beginning of the trial and tested again 1 month later. Results of the study showed those who used the Pycnogenol had a significant reduction in hyperactivity, improved attention and visual motor skills, and better concentration. The study concluded the Pycnogenol could be used as a natural supplement to relieve ADHD symptoms in children. Recommended doses of pine bark extract containing 95% pro-anthocyanidins is up to 100 milligrams 3 times per day, or 1.4 milligrams per pound of body weight. So if you're 200 pounds, your daily dose would be 280 milligrams. Higher doses should be divided equally, with your first dose in the morning, the next at lunch, and the last at dinner time. Pine bark extract is water soluble, and it can be taken with water or mixed with a smoothie. Side effects of pine bark and pycnogenol are rare when taken in doses ranging from 50 to 450 milligrams per day. Very rarely you could experience dizziness, stomach problems, headaches, or mouth ulcers. Pycnogenol can boost your immune function, so if you're on medication for autoimmune diseases like multiple sclerosis, lupus, rheumatoid arthritis, or others, or taking an immune suppressant for an organ transplant, you should avoid using pine bark or pycnogenol. High doses of pycnogenol can increase bleeding. Very high doses of pycnogenol can decrease blood sugar. Pycnogenol can slow blood clotting, so stop using this if you're planning on having surgery or dental work. And while there's no scientific evidence, there's user reports that the pine bark seems to amplify the effects of alcohol. Pine bark extract easily crosses the blood-brain barrier, and it's available within an hour of taking it. Effects are more typically felt within 6 hours. The pine bark extract is especially helpful for people who are suffering from brain fog and memory loss. It helps to increase cerebral blood flow, and it brings more oxygen and nutrients to the brain cells. Pine bark extract is helpful for people who are dealing with ADHD. Research shows the extract helps to prevent the elimination of dopamine and norepinephrine in the body, and this is a common problem with those who are dealing with ADHD. Taken for ADHD symptoms, pine bark extract helps to reduce hyperactivity, to improve focus and attention, improve memory, and put you in a better mood. Pine bark extract is also helpful for people who are suffering from Alzheimer's. It's been shown to boost blood flow to areas of the brain affected by amyloid beta protein aggregation, and it can even prevent the proteins from forming. The extract can help to tame inflammation that's associated with diseases like Alzheimer's, and studies are now underway to determine if the pine bark extract can help to prevent Alzheimer's from taking hold in the first place. You can safely take up to 450 milligrams of your pine bark extract per day, split into 3 doses of 150 milligrams, one with breakfast, lunch, and dinner. And for memory, pine bark extract is great when also taken with most of the racetams. Users also report good success by stacking it with Bacopa monnieri, lion's mane, and Rhodiola rosea. For more information about herbs, supplements, and natural treatment plans, check out my website.